Well, time is running out now for the legislature to pass a bill that advocates say will help lower sky-high prescription drug costs. But pharmaceutical companies are warning the measure would be bad for consumers. News 12 New Jersey's Alex Sedan picks up the story from Trenton.
Drugs don't work if people can't afford them.
This is a problem that impacts residents in every corner of our state.
Why are the prices of prescription drugs so high, and how do their costs impact your insurance premiums? To a certain extent, the public doesn't know. Advocates say they want to
finally shed some light into what has been a very tightly sealed black box. How much are patients and payers really paying for drugs? How much are drug manufacturers spending on things like research and development?
Senator Troy Singleton thinks he has a way. A bill he's sponsoring would create a prescription drug affordability board to probe drug company pricing and propose solutions, potentially including price controls. On Wednesday, he held a State House news conference to
frankly plead with my colleagues in the Senate and Assembly to pass this bill during our lame duck period and get this to the governor's desk.
It is not right that Americans are paying so much more for the same medications than the rest of the world.
Neptune resident Jared Schechtel knows about the issue firsthand. Medicine for the Crohn's disease he was diagnosed with as a teenager cost $6,500 a year. He had to leave college recently because he was diagnosed with Kinsborn syndrome.
This added a new layer of medications and hospital stays to my life. And I'm not sure if I can even go back to college, as I fear the price of my medications is significantly more important than my education.
Jared can stay on his parents' insurance for the next few years, but many others are not so lucky.
People shouldn't have to choose between buying medicine and paying for food, but they are.
Business groups oppose the bill, warning it could force research and development out of New Jersey. And pharmaceutical groups have warned the bill could create a devastating impact on patient access. Singleton says he wants to talk about lowering prices.
And it leaves me a moment of pause as to why they don't want to have that discussion.
Singleton has just over 1 month to get his bill passed by the Senate and Assembly before it expires. In Trenton, Alex Sedan, News 12, New Jersey.
Similar panels have been established in Maryland, Maine, New Hampshire, Oregon, and Colorado.